We found that 60% of deaths due to heat last summer in 2022 were due to climate change. Inequality is an important driver of impacts in climate change. Mental health patients are not considered today as vulnerable populations.
Vicedo, you're an assistant professor for climate change and health at Berne University. And we need to know, are people dying in Switzerland because of human-induced climate change?
Yes, according to our last study, we found that 60% of deaths due to heat last summer in 2022 were due to climate change.
How do you know if heat was the cause of death?
Well, unfortunately, we don't have estimates from the registry whether a person died because of heat or not. Nowadays, we know based on physiological studies and epidemiological analysis that part of the deaths that we see due to cardiovascular diseases, respiratory diseases, were in a way driven by heat. Just because this population already affected by chronic diseases were more susceptible to heat, and eventually they needed to go to the hospital, or eventually they died because they were exposed to high temperatures in the last 1 or 2 days.
And how do you know if human-induced climate change was the cause of death?
Well, basically we perform what we call attribution analysis, that in a way we compute what would have been the burden or health burden due to heat or other environmental stressors in absence of climate change, and then we compare it to the actual estimates that we have. And basically this difference is what we assume that it can be attributed to climate change.
You have contributed to the IPCC report, to Greta Thunberg's climate book, and you have published an impressive body of research on climate health with over 80 publications. What are the most important findings from your field?
I think it's difficult to choose, and in my opinion, probably these studies that we are doing right now on attribution, basically to estimating what is the contribution of climate change, is really, let's say, a type of evidence that is, in my opinion, bringing a lot of influence and a lot of impact to nowadays in our society, and especially to stakeholders, to do something about the climate crisis.
What role does inequality play in regard to climate health?
Based on current evidence, we have seen that inequality is an important driver of impacts in climate change. So basically we know that people that are more deprived or with less resources are those more affected by the effects of climate change on human health.
What are the most surprising findings?
Yeah, I would say that, for example, we have performed some analysis in specific population subgroups. And for example, one for me that it was especially impressive is that we have seen that high temperatures affect health state of patients with mental conditions. This is an important finding because before, let's say that the mental health patients are not considered today as vulnerable populations to high temperatures, and I think that these initial findings could help that in the future these will be considered as part of this vulnerable pool of individuals, and eventually, develop specific strategies to protect them from high temperatures and other environmental factors.
Sometimes I feel like we produce more and more findings that confirm what we already know, yet nothing happens. What is your reaction? Yeah,
I fully agree. Sometimes it's a bit frustrating to see that we are producing so much evidence, so much based on high-level research and using very, very ambitious and very important data sets, and eventually nothing is happening. In my opinion, I think that we, as researchers, we have to change a little bit our approach and try to focus more on the needs of stakeholders and provide evidence that would help them directly to develop strategies to protect population from the effects of climate change.
What are the research questions for the future?
Well, I think the most important thing, in my opinion, is to try to understand better the vulnerabilities in order to develop adaptation strategies that would be more efficient to protect them from the effects of climate change. This entails, for example, understanding how different mechanisms affect human health, coming from acclimatization and proper, let's say, benefits from interventions that can protect population from the effects of heat, and eventually try to develop that in a way that it's in a way sustainable in time and as well easy to implement in places with low resources.
Thank you so much for this interview.
Pleasure. Thank you.